Alright, my name is Marissa and I'm going to be doing my video on drawing labs from central line. So the first thing I have is my patient's chart here. My patient's name is Jennifer Doe. She has no known drug allergies listed. So the first thing I'm going to do is I'm going to gather my supplies here. I'm going to have 3 10 ml syringes of saline, an empty 10 ml syringe, hand sanitizer, some gloves, some tape or labels, whatever the protocol is for labeling your blood draws at your facility. I have a cap here that I'm going to replace when I'm done, vacutainer, some alcohol swabs, and then the correct tubes that for each lab draw that is ordered. Also here I have an order of filling the tubes, so I can note that the first one I'm going to fill is my blue one, and then I'm going to do my red one. Alright, so then before entering the room, I'm going to wash my hands. And then knock, knock, knock. Hello, Jennifer. I'll provide for some privacy. Hi, Jennifer. My name is Marissa, and I'm a student nurse. You have some labs ordered here that I'm going to just take off your central line, if that's all right. And she says, yep. And I say, okay, can you tell me your name and date of birth? And she says, Jennifer Doe, 11/5/1975. Jennifer Doe, 11/5/1975. All right, that is correct. Jennifer, we have that you have no known drug allergies listed. Is there any allergies that we don't know about? And she says no. So, all right, I'm going to go ahead then, and I'm going to prep my supplies. So the first thing I'm going to do is I'm going to get all the extra air out of my saline syringes here. Well, that one's on there. There we go. Alrighty, and then actually for one of my last flushes here, I'm just going to go ahead and attach it to my cap right away. Keeping that end sterile, going to attach it, and then I'm going to flush this cap right away as well. So that's all set up and ready to go. I'm going to bring my syringes closer to me. And before putting gloves on, or I guess I can put gloves on right away, but I just want to note that her lumen is the clear one for drawing the labs, or the proximal lumen is what we're going to use, and that it is at least 4 French to draw labs off of it. If she had any IVs going, I would stop the IV at least 2 minutes before drawing any labs off of it. If it was a life-threatening medication, I would just note that I didn't stop the IV and make sure that's okay for the facility. If TPM was running, I would not be able to draw any labs off of it. Alright, so then I'm going to go ahead and I'm going to take my alcohol swab here. Like I said, I'm going to take my clear one, and it says right on there my proximal one. And I'm going to, I'll grab a new one. Take my alcohol here, and I'm going to swab the top. Alright, and then I'm going to grab my first saline flush here. I'm going to connect it. I'm going to unclamp, and I'm going to flush. Alright, and then once I'm flushed through, I'm going to keep it connected, and I am going to draw back 10 mLs of blood here. I'm going to reclamp this, and then once I take this off, this is actually going to be my waist. So I'm going to set that aside to know that that is my waist. I'm going to grab an alcohol swab again, cleanse the top, connect my empty syringe. I'm going to unclamp, and I'm going to pull back 10 mLs again. When drawing back my labs, I'm going to draw back approximately how much that I needed that is noted in my tubes, and it says right on there. And for mine, I need about 10 mLs, so I'm just going to go ahead and take that right away. So I'm going to clamp again, and I'm going to take this off. I'm going to open this right away. and just leave this connected onto here while I finish my flushing. So then I'm going to grab another alcohol, and I'm going to do my first flush afterwards. So I'm going to take my saline, unclamp, and I'm going to flush. And I'm going to clamp. Undo this. And then for my last one, I'm actually going to, this is sterile, so I'm actually going to take off the cap here, just like this. And then I'm going to take off this cap, maintaining sterility. If this was on a PICC line, I would have to do a pulsating motion for my last flush here, but since it's not, I can just go ahead and I can just flush this through. And I unclamped it before starting to flush. And then once that's flushed through, I'm going to go ahead and reclamp it, remove that, and then that's my new cap that I have on there. Now going back to my blood here, I have this filled with blood, and I have this vacutainer on there. So I'm going to go ahead and I'm going to do my blue one first, as I said, and I'm going to pop that through. And then based on the air, it'll take what it needs. I'm not going to push on the plunger itself. Once it's filled up, I can take it off and I can go back and forth since there's additive in there to get it mixed up. And then I'm going to go ahead and do my red one. And then it'll fill it up the rest of the way. And then I got that one. This was my excess, my original blood that I have to get rid of. And then this is the one with the vacutainer. Both of these I would place right into my sharps container. I would go ahead and I will label per protocol for facility what is needed on the tubes before sending it to lab. I would do it over the label so that the lab is able to still see through each vial. And I would either put it in a biohazard bag and or again whatever facility calls for, and I would ship it to lab. I also want to note that per facility, it could be the last flush, could be heparin. It's whatever their protocol calls for. I did saline, but again, they could have heparin ordered to do it afterwards. When I'm done, I'm going to clean up my supplies here, throw away whatever I'm done with, and then I am going to make sure my patient is in a safe, lower the bed, put the railings up, give them the call light. A modification that it could be for this is a child. If there's a child with, or a child that I was doing this on, I would probably have the parent in the room to make sure the child wasn't moving while I was drawing the blood from them. Besides that, I would remove my gloves. I would wash my hands, and then I would leave the room and I would document. And for documentation, I would do the date, the time, and what I did.